If you're a loved one who has been diagnosed with cancer, you probably have a lot of questions. And among those questions, you may be wondering, how did this happen? While certain exposures, such as cigarette smoke, increase the risk of cancer, cancer is a diagnosis that can happen to anyone. So why does it happen? To answer this question, we have to think small, but then we can use that information and turn it into big advances. The human body is made of trillions of tiny cells organized into different organs like lungs, brain, and so on. Despite how small a cell is, think of it as a large and complex factory and distribution plant where millions of products are made and distributed to various parts of the body. The cell has 42 million proteins that do all kinds of jobs to help keep our bodies healthy. One of the most important jobs of a cell is to make a new copy of DNA and divide itself into two cells through a process called mitosis. Our cells divide on average once a day, and every time the cell divides, this DNA has to be accurately copied since it contains the code for everything that happens within the cell. Unfortunately, sometimes during this process, errors occur. These errors are called mutations, and over time they can add up and lead to cancer. The longer a person lives, the more cell divisions occur, and the higher the risk of mutations leading to cancer. Certain exposures, such as cigarette smoking and the damaging rays of the sun, can accelerate this process, but the driving force is the passage of time. We can and should avoid those things like cigarette smoking. However, we can't escape the risk factor of aging. The good news is that as we understand more and more about the mutations that lead to cancer, we are finding new ways to target cancers by identifying mutations in certain genes. We now routinely check a person's cancer cells to find out which genes have mutations. And in many cases, this allows us to target the cancer with targeted treatments other than chemotherapy. This is a growing field, and it is very exciting to be a part of it. To learn more, contact Samaritan Hematology and Oncology consultants.